and welcome to The World Today. I'm Hona, live from Beijing. We begin here in the Chinese capital. Chinese medical experts and physicians are explaining the current situation about the respiratory diseases in the country. Let's go live to the scene.
Rather than rely on speculation and joke.
Dear friends from the media, good afternoon. Welcome to the press release organized by the National Health Commission. As we enter winter, we also enter the high season of respiratory disease. China CDC is working together with the National Health Commission in studying the situation, and we are promoting the popularization of influenza vaccine. We are guiding experience sharing and technical training according to our study. We are mainly witnessing influenza. We also have COVID, mycoplasma, pneumonia, and other diseases. According to analysis, we are witnessing a rising trend of respiratory diseases overlapping with other diseases. Medical institutions at different levels must mobilize our resources and improve our treatment capacity and preparedness. At the same time, we have to increase the number of clinics, increase the supply of drugs, and leverage the potential of traditional Chinese medicine, and improve our preparedness and standardized treatment procedures. In the meantime, we have to also provide information to the public regarding children's disease so as to provide convenience for the general public to obtain medical services. For schools, nursery centers, we need to decrease people gathering. We also advise the public to put on masks, to increase ventilation and wash hands often. We need to encourage the elderly and the minors to take vaccines, keep social distancing, avoid infection. If you go to a large hospital, there is a high risk of cross-infection. And if the minors in your family are not having a strong symptom, please refrain from going to major hospitals. And right now, the health authority and the medical institutions across the country have publicized the number of organizations that can provide medical support to the minors. And today, this press release will be about the prevention and control of respiratory disease in the winter. And we have with us Mr. Wang Huaqing, who is an expert in respiratory disease, and we also have Madam Li Yanming and Mr. Yu Kang from Beijing Union Hospital, and also Mr. Zhang Zhongde, Vice President of Guangzhou University of Traditional Chinese Medicine, and Mr. Ying Xumin, an expert from Hangzhou. Now the floor is open for questions. Before you ask the question, please also identify yourself. First question, please. Thank you very much. I'm with Phoenix TV. And what are the commonly seen respiratory diseases? Is there a vaccine for that? Thank you very much. Mr. Wang Huaqing will answer your question. Well, thank you very much for your question. Some of the respiratory diseases are caused by bacteria, some are caused by etiologies, and some are caused by mycoplasma. Amongst these diseases, there are flu, there are also, for example, mumps, and we also have chickenpox. And this etiology-based disease. And as for bacteria-triggered disease, we have pneumonia and many other types of diseases. And as for what diseases can be prevented by vaccine, there are in general 40 types of diseases, and some of them fall into the category of respiratory disease. For chickenpox, mumps, and measles, and this can be prevented through vaccination. And for influenza, in recent years, we have developed new types of vaccines which can be very effective. Let me also tell the public that right now in our country we have the implementation of our vaccination program that has significantly enhanced the capability of a lot of the medical organizations. And let me give you a set of data. For example, for a very long time, diphtheria has been a common disease in winter, but because of vaccination, this disease is dropping amongst the population. And at the worst time, we had more than 10 million patients infected with measles. But last year, only 6 million such cases have been registered. And for a very long time, there was also another disease called pertussis. And at the worst time, there were 2 million people infected with pertussis. But right now, it has reduced by 99%. So this is the effect that we have achieved with vaccination. This is closely related to the increasing rate of the population who have taken the vaccination. So we suggest to the public to follow the guide of vaccination program in China, and wherever you can, take the vaccine so as to prevent the infectious disease. I also want to take this opportunity to tell the public about our observation about the etiology. As was mentioned by the moderator, we have identified numerous etymologies. They are mainly influenza, and we found out that at different age groups, apart from influenza, there are other diseases as well. Between 1 and 4, we also have diseases related to the nose, and for patients aged between 5 and 14, there is this infection of mycoplasma, and also there is also this infection of adenovirus. And in the meantime, there is COVID. And for people aged above 60, we have lung disease, which can trigger the symptoms of a regular influenza. And according to our observation, influenza is the most dominant form of respiratory disease. And at this season, we have a overlapping of multiple etiologies. So in addition to vaccination, we have to take other regular measures against these diseases. All right, next question, please. Thank you very much for your question. I'm with Guangming Daily. The elderly, they are more prone to these respiratory diseases. Any particular advices to this group of people? Madam Li will answer your question. Thank you very much for your question. As this group of patients, they are at the older age, they have a weaker immune system, and most of them have some pre-existing conditions, and that is why they are very prone to respiratory disease. And when they do, it's very likely that they develop some acute situations. As was mentioned earlier, vaccination is the most effective prevention measure. This is also the season of the influenza. This is a seasonal phenomenon which occurs every year. For elderly patients with a pre-existing condition, vaccination is the most effective measure. And also we have to pay close attention to the changing temperature. Right now in the northern part of China, there is drastic change of the temperature every day. So when you go out, you have to pay attention to the temperature. Make sure that you wear warm, and when you are staying at home, make sure that the room temperature is appropriate. And if you are living in a place with very low temperature, make sure that you have some heaters or heating devices. Humidity is another very important parameter. If there is a very dry environment, you may become very prone to respiratory disease. And when you travel outside, refrain from traveling into a indoor place with people gathering. And when you have to enter such places, put on a mask to make sure that your hands are clean and increase ventilation. Each and every day, you need to ensure ventilation of your living space, and you can open the window at the middle of the day. And if you have multiple rooms in your home, make sure that the elderly member of your family is accommodated in a room that has a very sound ventilation. And also in winter, the elderly has to do a good job in managing pre-existing conditions, because once they overlap with respiratory disease, and those pre-existing conditions may get worse. So they have to be closely monitored. In the meantime, we have to ensure reasonable sleeping and nutrition, refrain from drinking alcohol, smoking, and maintain a healthy living style. Next question, please. I'm with China Media Group. Optimizing clinic service is one key measure against influenza. In recent weeks, there has been complaints about the difficulties in registering for clinical and medical services. So what measures do we have in place to optimize people's experience in hospitals? Thank you very much. Mr. Ying Xumin will address your question. So thank you very much for your question. In order to address the current high peak of influenza, we have taken the following measures. Number one, improve and increase the provision of medical services. Wherever a clinic service should be made available to the public, they have to serve the patients. Respiratory departments running 24/7, and without a tangible reason, they cannot close their service. And in the meantime, we have made it possible for nighttime services. Secondly, put in place a dynamic coordination mechanism for the coordination of medical supplies. We have been dynamically monitoring the data of patients. If there is an overload in hospital, we would trigger this coordination mechanism so that we can tap the potential of our resources and mobilize more patients and experts to outpatients clinic departments. In the meantime, we are mobilizing more support to medical organizations at the grassroots. And number three, we need to simplify the procedures for people seeking hospital support, reduce those redundant procedures, for example, for regular blood test, it can be significantly simplified, and you can consult a doctor while the result is being analyzed, and you don't need to pay up in advance so as to save more time in the hospital. At the same time, we have increased the personnel at the hospital so as to answer and address the questions that our patients might have.
Thank you. Now the floor is still open for questions. Thank you. I'm from the Voice of China. The immunization system is very important for treating the disease. Do you have any suggestions for the nutrition and the food selection for the public? Thank you. Mr. Yu Kang will address your question. First of all, I'd like to thank you for this question. Well, a sound immune system is very important, especially a sound food system is also important to the public, and we need to have a diversified food supply system. It cannot be addressed by a single variety. So we need to make it more diversified, especially in the winter season. How to achieve the diversified supply? Well, we have published a Chinese food supply guideline, which provides 12 varieties and that advises 25 categories of food for the people. We advise people to take more varieties instead of only one type. We also encourage people to cook for themselves and also for them to enjoy the company of their family members. And second, we kindly advise the people to take in high protein. The major supply of protein and the low fat is strongly advised for people's daily menu. For example, we advise low fat or milk with no fat at all. And the chicken and duck meat are also advised. And this will provide a very good foundation for people's health. We also encourage the people to have this food in a distributed way, to take the proteins in different meals, and this will provide great help for people's immune system. Thirdly, we encourage people to have fresh supply of fresh vegetables and meat. The total supply of vegetable per day should meet 300 to 500 grams for each person. And this kind of food should be also diversified. For example, our tomatoes and other vegetables are free choices. Carrots are also a good choice. So we encourage the people to have a diversified supply of vegetables. And people also should eat 200 grams to 300 grams of fruits per day, with a low or medium level of sugar, like apples and oranges, are all good selections. For the fruit supply, you should eat vegetable per meal and fruit per day. Fourth, you should make sure you drink a large amount of water, from 1,000 to 2,000 liters of water per day, like pure drinking water or tea are also good, but make sure you don't drink too much. So you should take in water regularly, and whenever you feel dry, just get some water. Last but not least, keep your weight at a moderate level. So you should balance not only your food, but also balance your weight. You should develop a good lifestyle and a good habit. And these are very important to protect your health and immune system. Thank you. More questions? Thank you. I'm from China Daily. From the perspective of traditional Chinese medicine, do you have any suggestions to the public for improving their health and immune system? Well, thank you for your question. Each winter, we see a peak and prevalence of the influenza. People with underlying diseases and other diseases, and especially the pregnant women and children, are the key group of the diseases. So how can we protect them from the influenza? Well, from the perspective of TCM, we need to address the root causes and set up a good foundation of the body. Only in this way can we guard against the cold. So we should take care of ourselves from several aspects, like dressing, eating, and transporting. For example, the temperature difference can be large in the morning and the evening. So if you inhabit in the north, you should close your window in order to keep yourselves warm. Another suggestion is to build up the strength of your body. You may take some moderate food like the lamb and chicken and beef, and you should avoid some food that is hard to digest. There is a Chinese saying that in winter you eat a carrot, and in summer you eat a ginger. Also, you can take some food with herb effect. So this kind of food can also protect your health. For example, the ginger, the ginseng, and other kind of herbs. And this food with the medical effect will protect your health. So if circumstances allow, you should ensure the good ventilation in your house. In some places where the temperature is very low as 30 or 40 degrees Celsius below zero, it is hard to open your windows, but find a way to ensure good ventilation. In the south part of China, we don't use air conditioners, but try to get some home appliances with a warming effect. And another tip is to take some exercise. The exercise are very important, and you can do some exercise at 9 o'clock or 10 o'clock in the morning, but avoid too much sweat. Another tip is to leverage on some assistive effect of the Chinese medicine. Like you can wash your feet with hot water. You can take some fruit bath. And the traditional Chinese medicine will help. And you can add some herbs into your fruit bath water. Thank you.
来请右侧区第2排最靠外边这位男记者。
Thank you. I'm from Xinhua News Agency. We know digitalization and information technology have been very helpful in improving the medical development. So, can you tell us something about this field and its application in the medical field? Oh, thank you for your question. Over the recent years, the Hangzhou municipal government has been dedicated to the digitalization process in the city. First, we use all kinds of measures to ensure the open access in the information system to their health data. We launched this health data on the open online system of Hangzhou government, where people can fully access their information on the registration for medical services and to get medicines, so that the people can get treated in a timely way and orderly way. Secondly, we improve the supply on the internet level. We open access to the treatment to fever, and also we launch exclusive medical service to our people. We also invite delivery service to people's household to ensure that people can have their medical demands met. And this can help us reduce the cross-infections. Thirdly, we have launched a cloud medical supply service. We also ensure those patients in a need for their transfer treatment. And people can open an ad registration, they can open a medical account online. In the past, they need to take 5 steps to finish a registration. But now it's just a one stop away. It's just 2 stops. And this highly improves their efficiency of transfer treatment. Well, thank you. The floor is still open for questions.
Thank
you. I'm from CGTN. I have a question concerning the elderly. The elderly is prone to be attacked by influenza. So what kind of factors are there to influence their diseases? And are there any prevention and treatment? Well, thank you for your question. Well, the elderly, as they are quite old, and they have a weak immune system, so they are prone to all kinds of diseases in the respiratory tract. They also may have some underlying diseases, and this will cut their immune effect as well. So they may also cause some respiratory failure and can cause severe results. So they are highly prone to the respiratory infections. Well, from a clinical perspective, the elderly, after they get the influenza, they may have abnormal influenza. For the regular groups, people may have some fever and coughs, but that's not the case for the elderly, especially those who are very old. For those who are not able to take care of themselves, we should put in place a daily monitoring of these elderly people. And we should be aware that the elderly are very weak in their respiratory respiratory system. We should monitor how they develop in their respiratory performance. And this may exert influence on their brain neuroscience, neural system.
Many of the reasons can cause a respiratory failure, so we have to monitor their situation, make sure that there is early identification of the disease. As for treatment, we need to ensure the following, and comprehensive treatment is very important. And for respiratory infection, we need to engage in antibacterial treatment. We need to identify the pathogen and prescribe some antibacterial drugs, make sure that there is effective and safe drugs prescribed. As we mentioned that when they develop respiratory disease and there are underlying conditions, we need to make sure that these drugs do not undermine the functionality of their lungs and kidney. As we mentioned that they have a lot of underlying and pre-existing conditions which may worsen the situation. So during the cycle of respiratory infection, it is crucial that we do a very good job in monitoring the health status of the patient. We also need to take very good care of the patients during hospitalization, because there is a high risk of declining health situation and also expectoration, and we need to ensure nutrition and make sure that we take in some easily digestible and high nutritious food. Last but not least, respiratory infection is an acute disease, but for the elderly population, they can trigger more sophisticated situation, and maybe you have cured your influenza, but there is other respiratory symptoms. So during the cycle of recovery, we need to engage in comprehensive assessment, and that covers the cognitive ability, the sleeping ability, their mental ability, etc., so that we can put in place targeted interventions and ensure early recovery. Thank you very much.
Well, that's Chinese authorities briefing the media on the current situation about the respiratory diseases in the country. For more, we're joined via Skype by Professor Wu Zhiwei from the Medical School of Nanjing University. Welcome to our program, Professor Wu. As you have heard from the press conference, what are the major takeaways from the briefing? What do you think are the major reasons driving the increasing respiratory diseases rate?
Well, I think there are many different reasons. One is that as winter sets in, that's what usually we will see a lot of respiratory tract infections such as RSVs, flu virus, and also the mycoplasma pneumonia. But this year, as we been suffering and going through the COVID-19, a lot of people actually did not have much infection during the previous 3 years. I think that's probably one of the reasons when we open up the societies and people's immunities against those viruses actually may be down. So that's why the infections are going up all over the country.
Professor Wu, the experts have given some advices of treating the infectious diseases. How can we minimize the risks of the respiratory infections during the flu season?
Well, I think we have to utilize our common sense in dealing with respiratory tract infections, particularly in the case that when you have mild cases, you don't have to go into hospitals, because in the mild cases, such as the upper respiratory tract infections, usually would only last 1 to 2 weeks, and eventually they will go away. For the viral infections, we do not have the specific medicines against the viruses. So the best way is stay at home, avoid the public areas, and have a good rest, drink a lot of fruit, liquid, and also if you are actually feeling pain in your muscles, in your joints, I would simply get some over-the-counter medicines such as a painkiller. I think this is probably the best way to avoid cross infections. In the severe cases, when you develop a certain, such as persistently high fever and also dizziness and loss of consciousness, or breathing difficulties, and then if that's what happened, then you need to go to a hospital seeking medical help. But in most of the cases, actually, what we saw in the winter in the past is that those upper respiratory tract infections will go away. For most people, they will be fine after 1 or 2 weeks.
Well, Professor Wu, what do you think can be done to boost the efficiency of the country's healthcare system, especially in coping with such emergencies?
Well, I think it's very critical that one is that for the medical service sector, they need to develop so-called graded health admission system, because you have to avoid the sudden surge of patients and coming into the clinic and the hospitals. One of the problems is that when a lot of people coming into the hospital systems, actually the hospital could be overwhelmed by so many patients, and if you do not actually deal with the situation properly, there will be a lot of cross-infections. I think it's very critical what we learned from the COVID-19 period is that we need to have a grading system for those severe cases that are admitted into the hospital. For those mild cases, that they should be sent back into their home, taken care of by themselves. The other thing is that the hospital need to focus on their resources or reallocate their resources in dealing with potential sudden surge of cases, particularly the infections of small children and elderly people who have some underlying medical conditions. I think those are the populations need particular attention. The other thing is that we need to stockpile some essential medical materials and medicines in dealing with severe cases. So those are the few things actually we learned from the past in dealing with respiratory tract infections. For the public, I think it's very critical that we need to just utilize our common sense. Wear your face mask, wash your hands very, frequently, and also do not stick fingers into your mouth and the nose. I think those are a few things actually we all know very well. Just that we need to observe, and we need to do the practice.
There's so much to be done to address the current challenges in the medical system. Thank you so much, Professor Wu Zhiwei from the Medical School of Nanjing University. I appreciate it. Well, you're watching The World Today. We will be right back.